Welcome everybody. I'd like to start by acknowledging that the land we're gathered on is the traditional unceded territory of the Algonquin Anishinaabe people. And what a gathering, thank you. I'm glad we've got such a turn-up and quite a few visitors from outside of IDRC. Thanks for joining us. Can I have a quick show of hands? Who cannot stay past the hour? We had planned this for an hour and a half discussion until from 11 to 12:30. Who cannot? Okay, just to allow time to ensure we've got some time at the end to interact with the audience. Thank you, and welcome to those who are not from IDRC to be here with us, a place where we're privileged to work to support low and middle income country researchers to do the work they do to solve problems in the context of their countries and generate solutions for development problems. And with that, we're here to talk about food systems and food systems change, which is part of the work of a couple of programs here at IDRC, and particularly the program that I lead, the Food, Environment and Health program. I'm Greg Hallen, program leader for a public health program focused on food systems change. I have a incredibly respectable panel of people here who I really appreciate have taken the time to come from a long way, some of them, to join us and meet tomorrow at the Canadian Science Policy Conference to share their lessons and experiences in pursuing food systems change and understanding how it's changing and what can be done better to improve our food systems. All of them have been leads on or associated with IDRC-funded research. That's how we know them. And do amazing work with a whole range of other people who we support. I'll start by introducing them. Alafia Samuels, immediately on my right, is an honorary professor of the Caribbean Institute of Health Research in the University of West Indies in Kingston, Jamaica, formerly the director of that institute, and congratulations on your retirement, Alafia.
Thank you.
So much to share. Marcela Reis is the assistant professor at the Institute of Nutrition and Food Technology in the University of Chile. Thanks for joining us, particularly considering what you've had to separate yourself from with all the turmoil there in Santiago at the moment. But thank you. Mary Labbe, professor at the Department of Nutrition Sciences, Faculty of Medicine at the University of Toronto. Mary, or perhaps we, neglected to recognise in her bio that was prepared for today and tomorrow that she earlier this year was presented as a member of the Order of Canada for all of her work, her lifetime work contributing to the nutritional sciences. So thank you, Mary. And Jean-Claude Moubarak, assistant professor at the Department of Nutrition, University of Montreal, part of the Transnut initiative at University of Montreal, which is also a WHO collaborating centre on nutrition changes and development. So thank you everybody for joining us. On to my proceedings. What we want to talk about, particularly from a health perspective, we recognise when people talk about food systems, there's a certain community that are predominantly talking about food systems from a production perspective. The supply side. These people have been working mostly on, from a health perspective, and the demand side change and changing the food environments that consumers experience. What I feel we'd like to do, and also to discuss through our discussion, is how we bring those communities together in common goals to change food systems for the betterment of health, environment and the economy. We'll get to that later in the panel. But first of all, I want to ask the panellists to talk about what they've observed change in the food system and the consumer food environment. And I'll turn first of all to Alafia. The food system in the Caribbean might be expected to reflect its reputation as a healthy tropical paradise.
Yeah, right.
Yeah? What's the reality and what have you seen change and what have been its impacts?
Okay, so over the past couple of generations, people have gone from eating from the farm to eating fast food. As the Caribbean has developed and disposable incomes have increased, all the fast food companies from North America and indigenous fast food companies are alive, well, and thriving in the Caribbean. And so because of price, convenience, taste, marketing, the food, what people are eating has changed. And so a lot of folks are eating ultra-processed, fast food, deep fat fried food, all of the things that are unhealthy. And this, in fact, is driving the NCD epidemic in the Caribbean. Our premature mortality from NCDs, deaths before the age of 70, is 2 to 3 times the rate that it is in Canada. Our people die young from NCDs, and that's the real issue with the food system.
Right, and the period of change, roughly?
So I would say, I don't know, 20, 30, 40 years since development and tourism and, globalization. Our food supply is now a global food supply. There are like 8 or 10 companies that control most of what most people eat. And it's not good.
And Marcella, what are you seeing? What have you seen, particularly in that sort of same time period?
Same thing, same trend. Early in the 80s, maybe in Chile, we get rid of undernutrition. And income start increasing, and the big food companies and fast food restaurants appear, and people rapidly start becoming obese. Now 50% of our 6-year-old children are either obese or overweight. 75% of adult population is either obese or overweight, so it's a big problem. And actually, we are seeing now maybe the result of doing a model where income or the big numbers are the main driver of success, and we have not seen health or even the planet health, like sustainability as another way of progress, and now we are declining in both.
Right, thank you. Jean-Claude's been working in Canada. He's brought a lot of experience from his PhD work in Brazil, but more recently experiences from West Africa. We had another panelist who couldn't join us, Julien, who's particularly working on Senegalese food systems change. Are you seeing much different? And how would you relate these kinds of experiences to what you're seeing in West Africa particularly?
There's a lot of similarities, but Senegal is still struggling with the double burden of malnutrition. So they have a lot of improvement in lowering undernutrition, but it's still around. And now what they're seeing is this explosion of chronic diseases over the last decades. I think hypertension is something like close to 30% amongst women. And the food environment is changing, and it's changing very fast. For example, in Dakar, over the last 15 years, just in terms of observing, you can see that the city is much more urbanized. There's way more food marketing than before. A lot of pollution, of course. A great mixture of formal and informal food venues. And so there's a lot of changes in the food environment, and consequently, there's a lot of changes in the food patterns. But we don't have a lot of data in those countries. There's no national food consumption surveys like in other countries like Chile. So there's a lot of research to be done to map the food environment and also map the changing dietary patterns. But we are seeing a lot of fast food, ultra-processed food getting into the market and slowly eroding the local culture based on cooking.
And Mary, your work's been in a lot of different countries, but in Canada, how do you contrast or compare this to Canada's transition, food systems transition?
Well, I mean, I think a couple of things I can say. I mean, obviously our transition occurred earlier. I mean, it's nothing to be proud of, to be a role model for lousy diets. But, I mean, the sad part is, in some ways, in a way, we had the advantage of having national nutrition surveys, having other things, and to see, and the alarm bell started going off, 20 years ago. We maybe did a few small baby steps, but, since the 2000s, we've done things that, have tried to address it. And I think what happens is we haven't necessarily got to a good place, but some of the data we've seen, like that Mafia residents from the Caribbean or Chile, they've actually passed us in terms of chronic disease incidences, prevalence of obesity and chronic disease. That's not to say we're low by any stretch of imagination. Just because they're 10% higher in obesity rates doesn't mean our rate is low. But, so I think we've got a long way to go, but I think we've probably stopped it, I hope. But in a generation, we're way beyond where we were, when I was a child, for example, or that. So, but it also says that you can stop it, but now we need to say we need to improve things. So we can't just stop and be satisfied where we are, because we still have, 50-60% of people, adults, who are obese. Well, that's nothing to aspire to either.
Right. Marcella, so let's talk about some of the solutions and the challenges you're facing as researchers. And Chile in recent times has been lauded for its leadership on particularly the law on food labelling and marketing. Can you tell us about the challenges you're facing and paint the picture of what that particular advancement has changed?
So with the preliminary studies, we understood that the ultra-processed food was a problem for our dietary problem. And so we got a way to stop their increase or their consumption, overconsumption, and the government passed a law that established that the food with a high degree of processing and that has been added with sugars, saturated fats, or salt will be a flag or label with a warning label, very clear and simple. So we have these octagons, black and white, stating high in sugars or high in saturated fats or energy or sodium for the prepackaged foods that are high in those nutrients. And those foods actually is like a package of measures, because those foods that are clearly labeled cannot be promoted to children, even like in the package or in the TV, radio, internet, and so on, and cannot be part of the school food environment. So cannot be part of the feeding program, school feeding program, nor be sold in kiosk or cafeteria. And that has, of course, now we have a completely different supermarket aisle for instance, breakfast cereals. You have plenty of octagons and no Tony the Tiger or other things. Is really incredible. And kids, because it's so simple, kids are just, you can see them discussing, arguing with their parents, like, no, mom, this has two logos, no way that we are buying that. And it's really amazing how in a really quick, because this happened in 2016, so 3 years ago, and it has changed a lot, the public perception and what you see, actually.
So some early signs of shifts in demand and norms.
Yes,
right.
Maybe it's too prompt to talk about social norms, but you can tell the young, like the preschoolers or the young children, like pushing their families, like it's the opposite of the bester power that we used to say. It's like they truly say, okay, I'm not taking that to the school, no way. They will laugh at me, and it's amazing. Now we need to see with our studies how actually diet is changing, and of course all what we need to change. But so far the very preliminary results are very positive.
Thank you. And Alafia, in the Caribbean, the CARICOM states, you've been working on a whole range of different policy initiatives. Some leapfrogging and domino effect in the different countries, including the influence from Chile. What has been your experience in generating that political will and sort of alignment between the countries?
Right, so the Caribbean community comprises 14 independent states and 6 overseas territories, colonies basically of the UK. And we are small countries. Only 2 countries, Jamaica and Trinidad, have populations over 1 million. So the rest of them are in the 100,000s and smaller. So there is a great impetus for political collaboration, and there is a Caribbean community that has been established in order to have greater cohesion and complementarity in the region. In 2007, the CARICOM heads of government convened a summit on non-communicable diseases, the first time in the world. And they came out with the Port of Spain Declaration, which listed a number of mandates for countries to implement. University of the West Indies, supported by IDRC, carried out a formal evaluation of this implementation of the mandates. And in fact, the booklet that you have on your seat is the results of those studies that shows all of the work that was done in evaluating the Port of Spain Declaration. And so what has happened is that when we reported the results of the evaluation to the heads of government, they in fact issued another communique in which one of the things they said is that we need to reduce marketing to children and we need to increase taxes on sugar, salts, and fats. Of course, a political declaration is a piece of paper unless the political will in individual countries is there to actually implement it. In Barbados in 2015, don't quote me on that. Recently, in Barbados, they implemented a 10% tax on sugar-sweetened beverages. Now, it's an interesting story because it was done for fiscal measures, not really for health. The IMF came and said, this is an easy way to get some money. You guys need some money. But, of course, it had implications, and Coca-Cola executives flew down to talk to the Prime Minister, who refused to meet them, and who implemented the policy, whether it's for economic reasons or health, we don't care, we'll take it. And so 10% tax, 6% pass-through to the consumer, 4% reduction in consumption of sugar-sweetened beverages, and an 8% increase in the consumption of bottled water. Now, we can debate about the plastic around water and so on. That's another kind of debate we may come to later. But the political will in the Caribbean has been, from the heads of government and from the ministers of health, has been there. Of course, we have this implementation deficit disorder. It's sometimes, that hurdle to get from policy to actual practice on the ground takes a little bit of push. And the IDRC project has really been helping us with that, in that we have been able to gather stakeholders together to map the food environment and really open their eyes away from just their little small piece of the food system to see the larger system. And it actually has influenced some of them in terms of their view of the system. So I should also mention that Barbados did 10% tax, Bermuda 75% tax on sugar-sweetened beverages. 75% tax on sugar-sweetened beverages. We need applause for that. Yeah. Right? And they are cross-subsidizing healthy food. So, yeah.
That is indeed an advancement, and we're going to come back to that, and we're going to come back to, inevitably, to the issue of industry influence. Yeah. But on this question of engaging the stakeholders, and particularly at the early steps in West Africa, you've got some recent experience on this, Jean-Claude.
So Senegal is known in West Africa to be a country with a strong leadership and strong political will aimed at public health. And so in 2016, the Ministry of Health, I've met representative of the Ministry of Health in Togo in a symposium organized by FAO on dietary guidelines. And there I saw that there was an opportunity to convince the government to think more broadly about food policies, not to think just about dietary guidelines, but to take the opportunity to think more broadly about what are the governmental action that could be developed to transform the food system, to have more healthy and sustainable food system. So what we did is we've completed over the last 2 years an evaluation of the food policies available in Senegal and how they are aimed at transforming the food system. And this evaluation is done through the Informus network methodology. And what exactly it does is that it brings together stakeholders from government, from NGOs, from the academia, from industry, to think about a more systemic and holistic vision around food and nutrition. By having these stakeholders evaluating together their policies, it provokes some interesting discussion, some debates, and it forces people to get out of their comfort zone and to have interesting discussion between the economy, the environment, and public health and nutrition sector. So through this evaluation of food policies, we hope we can try to change the mindset of policymakers and of researchers around food and food system thinking, because we are looking at what Latin America is doing in terms of policies, and of course we would like to bring that into the region, but before we do, we need to have a change in the mindset and in the way people and policymakers thinks about food and nutrition. And for example, Senegal is a country that has a lot of resources, but it imports most of its food and exports most of its food that it's producing. So why is that so? Well, because there's an economic incentive to do so, but it's affecting the health of the Senegalese. And so can we have more coherence in terms of policies, to have policy that could be good for the local economies, good for the environment, and good for the people? It's possible, but we need to have decision makers that are committed and also free and transparent. And so it comes down to the industry influence that we can talk about.
Which we will come back to. Okay. But given the range of experiences here, and you've all mentioned several countries, Mary, you've been involved in several multi-country studies, and you've sort of seen how different countries have moved ahead here and there. And I mentioned the leapfrogging effect before. How do you see that happening, particularly in your experience?
Yeah, I guess I can put it in a bit of a context. In about 2008-9, I led I'll use sodium as an example, the sodium reduction strategy for Canada. And that was a document because we recognized our sodium intakes in Canada were really high. I mean, virtually everybody had over the upper limit for the day. So that document gave a roadmap of what we should do, and then following that, Health Canada set some targets for the food industry in terms of these are the limits that food should contain, and created benchmarks over the years. Well, we were one country, the UK did it, Argentina did it, a couple other countries did it. That document, there at the time, around early 2010-12, there were about 2 countries that had really cohesive sodium reduction strategies in Latin American countries. And I also led the technical advisory group for the Pan American region, PAHO, on sodium reduction for cardiovascular disease throughout the Americas. Well, using the examples from Canada, we used that. We had 4 countries. We built on those targets. We made regional targets. So in other words, other countries didn't actually have to have their own set of targets, their own strategies. They used and piggybacked on the targets from the 4 countries that did it, and those were adopted throughout the Latin American regions. With funding from IDRC, and we started with Costa Rica, it grew into 5 other countries. We actually started monitoring the sodium in these countries, consumer habits in terms of how much they're discretionary adding for sodium, what are some of the what I would call social marketing campaigns that would be needed, and the evidence to actually change those behaviors. And so we actually created that evidence. So now we're at the place over from 2009. By 2012, we had 10 countries with sodium reduction policies. This year, we now have almost 20. So we've gone from 2 to 20 in less than 10 years. And now we have enough evidence, enough research, enough data that we're ready to set new targets for the Americas, and many more countries have it. So it hasn't been one country leading. It's been this leapfrogging, as Greg mentioned, where the data from one country has helped leverage action and activity in another country, and that whole community became larger and grew on each other's experiences. And I think that's really what we can learn, is it's not just one country. And so now I'd say Canada's ready to update its targets, and they had targets, and last year was the monitoring. It didn't do that well, and we find out that, some of the other countries are actually doing better than us. So it really says that, it's not just something that's happening in isolation in Canada. We can actually learn, evolve, contribute to that growing momentum in a large number of other countries as well.
Thanks. So the next question I want to ask is really around, given all this context to all of you, but maybe you can start off, Mary, given that you were talking about evidence. What do you, in the next few steps in food systems change, what do you see as the most valuable evidence you would like to see, or what is the most valuable evidence you've used in influencing policy change?
A couple of things. I think, just the data. Somebody said if you haven't measured it, you can't change it. So, I think as a community, we're building and collecting evidence around, whatever food system, whether it's sodium, whether it's sugar, and then the effectiveness of these sugar-sweetened beverage taxes. People are collecting them now. So that's one thing. I think some of the things that we're hearing that governments need is more data on what we call the cost benefits, cost effectiveness of these programs, because let's face it, enough about whether the sugar-sweetened beverage taxes were brought in for economic reasons or health reasons, they're going to have benefits on both sides. And we need to cost them out, because that really, many of the times you have to convince us finance ministers. So I think, cost benefit is another area, and we're not as good and we don't have as much data around the world. But I also want to put in a plug. The other side is, I'm a researcher, and I say we always need more money, need to do more research. But I'm a policy advocate. I really think there's a real role for policy to change food environments. So I think we also can't use that desire for evidence to be a roadblock or stumble to delay. We can do evidence from local context, but there's a lot of evidence out there that a lot of these food policies really do work, really do shape healthier food environments. So, I think there's lots of opportunities to do forward, and even though we want more data, don't use it as a stumbling block to progress.
Right. Marcella, Alafia, do you have anything more to say on that in terms of the most valuable evidence, and what of this point of using evidence from other countries versus having to generate it all yourself?
Yeah, I think that, as Mary said, we have to be very careful about being caught in the trap of let's research, and so we don't have to do anything while we're doing the research. But I think that it's also important that, I think it differs depending on what you're talking about. If you're talking about smoking and lung cancer, we don't need to research that in Jamaica, because our lungs are the same lungs that you have in Canada. So that's pretty straightforward. But if you're talking about something like food culture, then sometimes you may need to set the context in a different country, because when you talk about culture, then there's a whole history behind it. So just to mention, for example, there's a new project, not IDRC funded, but still important, new project out of the University of the West Indies called Foodscapes. And they are merging historians with public health people and nutritionists, because they're tracking the history of food consumption in Jamaica, going way back to the start of the country through the slave trade and coming up and so on, and seeing the individual particular cultural influences in the country, so to be able to understand why people eat what they eat. Because, qualitative research and research that tells you why, not only what, is very important, because, people love the unhealthy food that they're eating. And that's something that we really need to recognize and to sympathize with and to understand why it is. And then you can engage and connect and then try and bring them with you. But the preaching thing is not going to work. So let's not preach.
Jean-Claude?
Yeah, I just wanted to follow up on the preaching. I think, because I think it's interesting. I absolutely agree. We absolutely need evidence. But if we think about the climate crisis right now, we do have evidence, but we have a lack of action. So in itself, evidence is not enough. We need to change, how can we change the mindset of consumers, of corporations, of decision makers? We need to talk about values and change in maybe the value that we put in food. Maybe we should build more narratives to trying to bring together different arguments. If you're going to talk about food culture, I don't think we're going to have the same level of evidence. So we're going to have to build narratives and have arguments around principles and values so that we can convince people to change their mindset. And I think researchers can have a role in inspiring people to change. But it's, I think we need more than evidence. We need values and we need principle, because we can have the same level of evidence and have two different government policies based on different principles.
There's a general comment, and it sort of goes in the direction I was wanting to in relation to this eternal debate about the role of researchers and where their role ends. You've all had or have academic roles. What's been your experience in relation to using that evidence and the challenges you've faced in balancing that role? Marcella, did you want to speak to that?
Yeah, and linking with the other question also is like, first of all, asking relevant questions. So not just scientific, but thinking how to move forward, what is needed for a policy change. For instance, in our case, we knew a lot about that we were fat, that we were dying and everything, but then we needed to understand why. And so shaping or monitoring the food environment, at least our country do not monitor food environment. So explaining that, like, I don't know, the princess or whatever cartoon is on this particular food, it's not good to be there because that particular food has more sugar or more saturated fat and is targeted to children, kind of make a difference in policymakers and even in people. So just understanding what is needed to a change, and then in our case, having no conflict of interest in the funding of that research, and having building a relationship with policymakers. It's important. So whenever the government is renewing, like sitting with them again and saying, okay, we have data on this and that, because our governments, at least I think yours will be the same, do not have a big statistic office or a lot of information. So we do have something that they need, and putting there in the table the data for them to make decisions is something that start building trust. And I think that has been very key for us, at least.
Did anyone else want to comment on that, the role of the researcher? Alethea?
Yeah. I just wanted to share an experience that I had where there was an external review of our research institute, and I was presenting on some of the work that I have been doing on these projects and some of the activities. And one of the comments from the reviewers was that, you should be very careful to keep the line between the researcher, who is supposed to be objective, and the advocate, who is seen as being, on one side. And recommended to me that I should try and do less advocacy. And I said, well, we come from small islands. We don't have all these people to do all these different things. We have to do everything. So as a researcher, I'm a very strong advocate. In fact, the Lancet Endocrine did a feature on me, and the title was Fast Food Watchdog of the Caribbean. Because I'm very, there are some fast food companies that are marketing in schools and providing products in schools for children, and it's just wrong. And I speak about that and speak about it passionately, and I don't think that compromises my research, integrity at all.
And Mary, a member of the Order of Canada and academic researcher, how do you approach that role?
I think first and foremost, as scientists, as Marcella said, investigate policy relevant questions, which I think, if we're going to really shape policy, ask the right questions. And then really be good researchers. So have good quality data that you're confident in. And then secondly, make opportunities. If they don't come to you, make opportunities to share that data. And I mean, many cases, it's not just talking to other scientists. They've heard it. But, for example, I often say I work with many intermediaries. And in Canada, I use the Heart and Stroke Foundation as an example. So I made sure that they had all of our data, as well as government, that they saw our data. I send them copies. I write them letters. Here's, a recent study and that. But when you engage with them and make sure they know about your data, they're the ones who are often in the minister's office advocating on behalf of policy. But then in turn, they come around and say, oh, well, you should invite Dr. Labbe as a witness to the Standing Committee of Health or the Senate Committee on this. So because you've already informed them, they in turn put your name forward, and then you actually have those direct engagements with the politicians, the policy, the real decision makers in the country. So you may not necessarily have sought out those direct, and you probably never even would have gotten in the door if you just said, hey, I want to show up and talk to you. But by having already worked through those steps to making sure that people who can really affect change know about your research, whether it's in government or in the NGOs, they in turn often open those doors for you. So I think it's a bit of both.
Yeah. Jean-Claude, you?
Yeah, it's a very important question, and it's sometimes it's a question that I'm trying to think about every day, because I think in public health nutrition, it's really hard to do research without getting engaged, because the subject is engaging.
Everyone has an opinion on food.
Yeah, I mean, it's not that we want to be engaged, but eventually we are engaged, and because this is often a human right issue. So these are very sensible subjects we're dealing with. These are people living, and so it's really hard not to be involved. But I think, like Mary said, I think working with NGOs is a way for us to having them change their mindset also and bring forward a more holistic, systemic vision about food and nutrition to the government. So I think it is crucial to work with NGOs, and in some case we can influence their agenda and the research priorities as well. So, but I've been accused sometimes of being more an advocate than a researcher, and it's because sometimes I will use techniques that trying to communicate passion and something else than just hard data. But then there is sometimes a criticism that, wait a minute, this is not data anymore. You're not neutral, and it's really hard not to be neutral in such a sensible subject.
Thank you. So, to just think about Canada specifically just for a short while, as we can consider the shared challenge that we have globally on food systems change, and you've spoken to how these are shared challenges and everybody's up against it, and you've talked about industry influence, but Canada's not necessarily a leader on this one. Maybe in some respects, not others. What are the takeaways from international experience, your experience in your countries, that you think may be valuable for Canada going forward? Anyone?
So we still need to take time to see the complete success or not, or change driven by our regulation, but as I said, the first data seems to be going in the right direction, and it took a long time in Chile to happen. The first act was 10 years before than it actually was implemented. And we arrived to this point that more data is needed and more evidence, and no country has done it yet, so we cannot be the first one. So, okay, we already went through that. Now a lot of countries has it. I understand that Canada is discussing about the warning label. So maybe you could take the necessity of moving fast about this. We have seen there is a cost of taking no action. There is a cost about that. And so maybe moving forward faster with that, and including for us the package of actions associated to that was really important. Actually, we are trying to move forward with adding taxes on those foods, but the fact that they are already tagged or flagged, it's make very easy to put other actions on the food environment level on them. So do the whole package quick and just do it. That would be my takeaway.
Any other comments on that?
Well, I understand that Canada does not have taxes on sugar-sweetened beverages. And I would highly recommend that, because people always ask, well, why are you concentrating on sugar in beverages? Because there's sugar in confectionaries and other things and so on. It's because the sugar in beverages are very peculiar in the way that they are metabolized. So you drink a Coke and immediately your blood sugar spikes and your insulin spikes, and then you get a crash. So the sugar actually drops below your homeostasis level, and so you crave more food in another hour or two. The calories in drinks do not satisfy hunger, so you still have to eat food to get the satisfaction. And they're empty. Most of these calories have no nutrient value with them. And so for these reasons, we think that addressing sugar in soda and using all means necessary to reduce consumption is very important. And taxes is one of the things that Canada needs to consider seriously.
One specific policy example that Mary or Jean-Claude?
I think a couple of things we've learned from other countries, and I think we're still learning as researchers, is for food policies to be effective, and just like Marcella said, it's a suite of policies. It's not one single policy. If you're going to change the food environment, you have to change it through a number of touch points. And a couple of years back, we ran a process through my group at University of Toronto. It was called Food Epi, and I'm part of this Informers Network, which is an international network of people doing monitoring on the food environments to really reduce obesity and chronic disease. And I know IDRC has funded a number of projects using these methodologies. And what they've allowed us to do is to track food policies around the countries and to use the same set of measurements. So if you're going to see how things work, you're actually using common measures so you can actually make these comparisons over time and across countries. And one of the processes we did was a food policy analysis, and it was called Food Epi. And we really ranked the federal government and all our provinces in Canada and said, well, how are we doing in the food policy sphere? And one of the things we actually, as researchers, had collected, what are the best examples, and we call them benchmarks, around the world that governments are doing. So now we went and I met with all kinds of folks at Health Canada, Agriculture, and anybody who would talk to me. Some of them wouldn't meet with me, but can't hurt a girl for trying. And said, well, these are the benchmarks. These are the real food policies that are going on, that have already been implemented around the world, be it from South America, it could be Australia, it could be Asia, wherever. These are good examples of food policies that are working, that can shape the food environment. Here's where Canada is actually doing well, because we do some things very well, but there's other areas we're doing nothing on. So these are the examples we can learn, and this is the evidence behind them, these are the documentations. And so I think that kind of can work as a roadmap for governments to say, sure, we're doing great in some areas, but here are other areas. And it's not just one single thing. I think governments really have to think of food policy, if you're going to really affect the food environment, as in multiple tools. And maybe the tools you can choose are the ones that address our worst problems in Canada, but there's a range of them. And I think sugar-sweetened beverages are one, the front-of-pack labeling, restricting marketing of unhealthy foods to kids. But there are others we could be approaching in Canada too. And I think there's good examples around the world that we can follow.
And most of what we've been talking about so far is the policies that are being pursued for health benefits and from a health researcher's perspective. Early days yet for many of us, really, in trying to engage those other stakeholders with whom we still have a shared challenge in changing food systems. Those who are concerned about the environment, the economy, etc. Have you got some challenges or experiences to share in relation to that kind of engagement that we need to do more of?
Well, I think I don't have a direct experience with it, but I think some countries have experience with food procurement strategies that are very interesting. So, for example, in Brazil or in Denmark, they have linked the local agriculture to the institution, so that foods in public institutions are bought from local agriculture, and they're prepared and cooked on spot in hospitals, in senior citizens' houses, in schools. So this brings together the agriculture world and the nutrition and health world together, and it's often done not thinking about nutrition outcomes, but to support the local economies and support a good education for kids in school. So I don't see why we couldn't do that in Canada. But I think before we get there, I think we need to learn about other countries. I think in other countries, food is a very important subject. We just passed the last election here in Canada. We haven't talked much about food. So we don't really care about food. And I think when we go to other countries, we see how food is cared about and how it is valued. So I remember when I did work here for IDRC for a year, and I remember when we went in the kitchen, we had access to a very healthy meal cooked here on spot for like less than $5. I don't know if it's still around. But that was a beautiful policy, and we need to have this in all schools, hospitals, and bring back, for example, cooking classes into our schools. But for that, we need to care about food, and we need to have a civil society that is asking for that. And so I've learned that we have a very weak civil society in Canada. So we needed the civil society to push on government, to help government to do its job. And government is asking for that also. And so, it's in Mexico, one of the reasons why the tax was a success is because the civil society was very strong, very well supported by the researchers. So this is, I think, one of the things we can learn. In France, the school meal is a very important subject in municipal elections. So we need to start bringing food into our priorities, I think.
All right, thanks. So I'm going to... was there anything else you wanted to say on the LIFO? So before I turn it over to the audience, you haven't had much chance to chat amongst yourselves. Do you have any questions for each other at all in relation to what you've seen or heard or know about in relation to each other's experiences?
I want to know when the publication from Chile is coming out.
It's part of the challenge of being influential in policies that you don't have so much time to do the work. But we have had some of them published already. We have had accepted some that are not already there, but if you write me, I can share with you the ones that are already accepted. So on marketing and some qualitative data, everything funded by IDRC is out there now, and we are working on the one is under revision, the reformulation one, and the one that that is showing that sweet and sugar beverages has decreased in 25% the purchases of them. So we are working on that. They are under review. This is one of the challenges that research times are really different than the policy times or the social civil society times, but we are trying to go faster.
Yeah, and Chile really has done magnificent work, and we're all anxious to see, so we can use your example to advance our processes in our countries.
Of course, but for policy purposes, we are sharing those data with people that need to.
And Alfia, I think equally the sugar-sweetened Texas results from the Caribbean as they come forward to get those data out as widely as possible.
The Barbados one is published, but Bermuda, I think they're still evaluating it because it's recent.
Yeah, and a few other countries have adopted them now too, so at least the data are being collected and analyzed.
Other questions?
Maybe I have one question. To both of you, how do you perceive, or how you and your colleagues perceive the Canadian food policy environment? I'm curious to know. There's goods and bad things to talk about, but no.
I don't know if I know enough about to comment. But just being here for a couple of days, it's the same as we see everywhere else, a plethora of ultra-processed foods and fast foods and convenience foods and so on. So I really don't know, though. I can't make an intelligent comment.
I could suggest a bunch of other questions, but I think it's time we turn it over to audience questions. And we've got 2 mics, and I would suggest that maybe we take 2 at a time and use the mics, and we'll have you come up and introduce yourself and let us know your question.
Buba Husseini from the Employment and Growth Program here at IDRC. I have 2 questions. The first one is I want to understand who are the dominant research funders in this field. And related to that also, how do you ensure the research integrity in a context where, depending on who funds the research, it might also influence the research process and the research integrity. For example, a research funded by food industries can go in one direction versus another one funded by an organization like IDRC, which might be maybe more neutral. So I'm trying to say there are very strong other interests in this field, and you also know the power of money. So how do you really do research and ensure research integrity in this context? My second question is, I'm wondering what are really the efficiency of measure like fiscal policies or economic policies, given that it really depends on which consumers you are talking about. For example, if you looking on the extreme consumer like addict people and consumer, I'm not sure that by increasing their taxes you are helping them, because they will consume anyway. So their demand is not really very flexible, as opposed to people who are in the middle or average consumers who can respond more quickly to increases in prices. So how do you deal with this demand flexibility? I know if you look on the average, you might find probably effective measure, but if you want to look on specific groups, how is this working? And I think this is very important also in this principle of leaving no one behind. So we don't want to exclude a subgroup of people just because we're looking on averages.
Thank you. So that was 2 questions. Was there anyone else quite ready? And they're 2 fairly big questions. We were actually talking about, okay, so yes, go ahead.
Yeah, Phil English, former IDRC. I'll ask 2 questions as well. I like the example of Chile wonderfully, the preschoolers and the kindergarten kids telling their parents to change their buying habits. How did that happen, though? I mean, was there some kind of campaign that reached the children? Because that sounds a bit unusual. And then secondly, I didn't hear the word organic anywhere in the discussion today. And I know there hasn't been a lot of research on the impact of organic food on personal health. Are any of you doing that kind of work, and what are you finding? Thank you.
Right, thank you. So we'll that's a lineup, and we'll tackle those. So firstly, there was one about the dominant funders, and then also related to that, the industry-funded research, and then about efficiency of measures and the equity impacts of fiscal policies, particularly. About Chile's norm-changing legislation and particularly the role of organic foods in all of this. Okay, so anyone want to take a lead on any one of those questions?
I'll start with funding. Okay, a couple of things. One, I lead a WHO collaborating center on nutrition policy for chronic disease prevention, and part of that, I actually commit to not taking funding from food industry where it would affect food policies. And we've been involved with some funding from industry, but it's been very broad, like analyzing CCHS, our nutrition survey data. So it's not where we've done commission research on their behalf. But I think where are the major funders? I think for most researchers that I'm aware of, their own country, their own local funding. And I can say I've benefited from research funding from CIHR for a number of years. I mean, the first impetus of doing my IDRC funding was basically we took a CIHR funded grant, restructured it in a, put in low and medium income country data, leveraged it up, rewrote it again, submitted it, and got our IDRC funding. Sorry, Greg, but that's how a group of us did it. The second one, I mentioned some of the Informas work, which is that international network of food monitoring. We actually, a group of us got a grant from the Rockefeller Foundation. We got a week to go away and do, brainstorming and thinking of people. That's what you do. And there were people we knew from conferences, and they were working in the same area. The other funder, I've been fortunate with not only IDRC funding, but Bloomberg Philanthropies have funded a lot. And these are funders like IDRC and Bloomberg, Rockefeller. Most of their funding is really focused at questions. They're addressing the issues of low and medium income countries. So Bloomberg won't give us money to work on the food policies in Canada, but they will fund issues around food policy, healthy food environments, and the resolve to save lives, vital strategies are the big initiatives right now. So that's probably some of the main big funders, but there are many other funders out there that I haven't been benefited from.
So just to say that Bloomberg does work in the Caribbean, and has been helping with the advocacy around sugar-sweetened beverages and working with other things. The University of the West Indies Public Health, Medicine and Health, Public Health, have a policy not to accept funding from industry, quote unquote. Some of the other faculties do research for industry, and so like engineering will try to address the oil industry's problem of how to do whatever. But in health, we do not take funding from any of these agencies, and so NIH, IDRC is my big friend and funder. But we, the institutes also get quite a bit of funding from the National Institute of Health and so on, and Bloomberg and others. So we are very careful about that because we recognize that. But the second question you asked about the different levels in society and the impact and so on. The soda tax is regressive, but so are NCDs. So it is appropriate that you have a regressive tax for a regressive disease. Poor people suffer more from NCDs. So the fact that the tax hits them harder and changes their behavior more is a good thing. Usually regressive taxes are not, but in this case it definitely is a good thing. Whatever public policy you put in place, it's not going to be a magic bullet for everybody. There are wealthy people who want to drink Coca-Cola, who no matter what the price of Coke is, they're going to drink it. We can't address everybody at the same time. But for the majority of people, the taxes and so on will cause behavior change, and we have seen that happening.
What about the impact on poverty? Because if you
drink water instead, it's cheaper. So that's poverty right there. You've saved some money.
So this is a question. You want to come back to that?
I just want to make a point about catastrophic health expenditure.
Mattia, could you use the mic, please? Yeah.
So, as all our colleagues will probably speak to this, a big leading factor of financial precariousness is catastrophic health expenditure. My tiptoes don't quite work. And NCD risks and exposure is one of the leading factors that leads to that. So we see this in tobacco, we see this in diabetes, we see this in lots of other things. So in fact, this is quite a poverty reduction measure because these tend to be people with the least coverage, especially in the countries that we work in.
Nevertheless, a pertinent question that will repeatedly come up time and time again, often asked by the food industry themselves, or spokespeople for the food industry. Can I, so welcome to tackle any one of those questions, but Marcella, how did that change occur, and how did the impact of that change, in terms of its norm-changing influence, how did you see that roll out, and how have you measured that?
So this was not expected. We are no longer a low middle income country, but this is the average. If you disaggregate, we don't have a lot of money for policies, health policies, so there was a campaign, but a very limited campaign. But actually, we didn't realize until it was there, but the policy itself was a campaign, because the logos are everywhere. We have a lot of food that is high in either sugar, salt, or whatever, so you can see the logos everywhere. It's impossible not be aware about the campaign. And actually, people doesn't understand so well that there is a linkage to marketing restriction and school environment, because they just see the logos. And actually, that's the beauty of IDRC funding us, that besides the funding, they have advised us to do some qualitative research during the funding. And because of this research, we have interviewed a lot of different mothers from different socioeconomic background, with different kids from different ages. And this fact has shown that they were saying, okay, my kid, I need to bargain with them how many logos the food can have. And actually, I have like a 10 years old son that didn't put me so many problems when he was 5. And now I need to bargain with my youngest kid. And it was very interesting, but it appeared there. And then you can realize, oh, yeah, it's true, I have seen that. That paper is published, so you can find that. But it was the measure itself. And actually now you can see, with all the demonstration and everything, you can see some octagons, black and white, saying alto en abusos, like high in abuse from the government, or high in different things, because people, like the logos are everywhere. Like it just happened. And for us, just going to funding, having funding as IDRC, and we are also funded by Bloomberg Philanthropies, is key. As again, we are not a high-income country actually, and the funding for research is very small, and it's very like scientific research, like A plus B is C, and it's not to move a lot forward. And so this funding that is also advising you to help and to have like to participate with policymakers and things has changed completely our way to move. It would be impossible to do what we are doing without this kind of support. That is not just money, but what they are actually paying to study. It's key for us and the movement there.
Thank you. We've nearly touched on all of those questions, except the one about the role of organic foods.
I can say a little bit, not a lot. We actually have, I'm not even sure if it's published yet, but if it isn't, it's well in a way. We've completed a study. We have a large branded food database in Canada. We call it FLIP, which is Food Label Information. We collect, since 2010, we've gone into the grocery stores and we collect every food with a nutrition facts table in the stores, in the largest grocery stores in Canada. One of my students ended up saying, well, our people were looking for organic foods all the time. Are they any healthier? And one of the things we did look is we compared all the nutrition facts tables for the foods that have organic, natural, and guess what? In most cases, they're not that much more nutritious than, from at least from the nutritional quality point of view, than comparable foods. I would say, if anything, the word organic actually is a tightly controlled word, and those foods actually, there's fewer of those. Now what we're seeing the food industry use things like natural, 100% pure, because those words don't have restrictions by the Food Inspection Agency on what the composition, on what they can do, and they have, so we haven't looked at things like pesticide use or anything else, but we've just looked at nutritional quality. Very small marginal differences, if any at all. But the interesting thing is we're seeing the food industry gets around some of the restrictions on the use of organic, and we see many, many more using all these other comparable words that don't have regulatory or policy requirements around them. So food industry will follow the market sometimes too. Consumers are asking for them. Consumers think, we've done some research, consumers think those are healthier, more nutritious foods, but the data doesn't actually hold it up from a nutrition point of view.
Irrespective of the the evidence around the nutritional impact, it still inspires another question around how much value is given to local food from a consumer's perspective, and how much that influences people's perception of their of their food environment. How much is that playing into food policy discussions, and particularly perhaps in the Caribbean, where there's an acute issue with a reliance on imported food?
Right. So, like other small island states in the Pacific, the small islands of the Caribbean really are very dependent on imported foods because just the capacity of the country to, in a cost-effective way, produce the variety of foods that you need for a good and balanced diet. And so you find that there are countries that import 90% of what they eat. And the World Trade Organization says that you can't limit trade. So the importer can import whatever he wants, whatever quality the food is, the tinned foods with all the nitrates and so on and so forth. But to say, though, and to kind of connect a little bit with the organic question, yes, fresh fruits and vegetables are better for you, but in certain contexts, you have to recognize that small farmers need help to know how and when and what kind of pesticides to apply, and to be able to produce actually healthy foods that are not contaminated. And in some instances, there is a concern that some small farmers, because of the lack of regulation around pesticides and so on. I mean, there are some pesticides that are banned in other countries that are not banned in the Caribbean. And so there is a concern about that. But the organic thing actually is seen as a kind of elitist label, and the food is really usually more expensive. And so it's not really something that the average person is drawn towards because they can't afford it. It's more expensive.
Can I invite another round of questions? Okay, two over here. Yes.
Hi, my name is Olushola Shitune. I have a question for Marcella and for Alafia. So you've worked in your countries, you've seen how this tax, especially the sugar-sweetened beverages taxes, has been increased and how it's helping the people. Has it been done in such a way that there are people who follow up on the government to ensure that the money the government gets back from these taxes are actually used for the health and nutrition of the people? Because this was a big debate in South Africa when they were about to introduce the same tax, and people were like, who is going to follow up on the government to ensure that this money is not diverted into something else? And I use South Africa as an example because I did a study there, and in 5 years we saw how people transitioned from based on the transition and people moving into the urban cities, we could see how people are moving away from the traditional foods and how people are getting more obese and all. And people asked, who is going to, in quotes, police the government to ensure that the money that they get from the people and the companies will be used effectively to ensure that the NCDs actually do go down? So have you seen, is there a policy in place where you're from to address this?
Thank you. And so we'll take one more question and then we'll...
Hi, Craig Spira from Care Canada. I'm our head of food systems and resilience programs. And I wanted to follow up on something, Greg, that you opened with, that this panel is talking mostly about the demand side and looking at the demand of consumers for goods and how we change that. Well, how do you actually link it to the supply side? Care Canada is trying in many of our programs around the world, but we struggle with the policy and research linkage, and wanted to see how you do it. Because we know from very recent FAO analysis of FAO data that smallholder women farmers grow the most nutritious crops, and those crops do not reach the markets because of a variety of systemic barriers. How do we overcome that? And how do we improve the outcomes for both farmers and population in general?
Thanks, Greg.
And just maybe a shameless plug here.
Go ahead.
Care Canada and FAO are launching the State of Food and Agriculture report on November 26th here in Ottawa. And so we are going to be hosting an evening event here. And anyone who wants to know more, please let me know.
Worthwhile plug, thank you. Yes. So that was a question for me. I'll come back to it, but does anyone else want to comment on, particularly on either question, but the first one in relation to monitoring of government action, particularly in relation to specific taxes on food and beverages, and where that money ends up?
Yeah, well, I can tell you straight up, ministers of finance do not like this thing called earmarking, and they resist at every opportunity. So the taxes in Barbados are not earmarked for health. And as I told you, the origin of the tax was the International Monetary Fund, saying that you need money to support your general thing. So that's a big problem. Personally, my solution is we should call it a health levy and tell people that they're paying down on their care for their heart attack 10 years from now. So every time you buy French fries, you make incremental payments through a health levy. So when you get the heart attack 10 years from now, we'll have money to look after you. So let's not call it a tax. I think...
Indeed, in South Africa, it's called the health promotion levy. Yeah.
For us, the tax was very small, very, very small, and actually it went up for the beverage that has above a certain level of sugar, and went down for the other ones. So it didn't went through in every beverage, because for instance, the Coca-Cola company could play with they have the portfolio without sugar and with sugar, and they can play with that. And we don't have the health tag for the money also, so I think it hasn't be a lot of money, and it's not invested in health at all.
So, any other responses to that? I think, and yes, again, on the South African experience, as you may know, it's actually described as a health promotion levy. It's actually soft earmarking, and I don't think that's been well monitored yet as to where that money's being is flowing, nor is the health sector doing a good job yet as to helping Treasury identify where the money should go. On this question of connecting the demand side and supply side objectives, and indeed the communities that are often separate, we haven't got that all worked out by any means. We have two programs, at least at IDRC, that have food as a focus, but have done only taken the first steps yet in terms of connecting people, including through the project in the CARICOM, looking at both demand side and supply side measures. I think when I think about this, I also think about some of the what Jean-Claude was touching on, the discriminatory policies, if you may describe them as such, that consider local food producers' livelihoods to be advantaged when you require that institutional food must come, at least in part, from those suppliers. In Brazil, it's a 30%. 30% of all school food has to be derived from local family farms. The workshops we've supported in every region, actually, there's been an expression of interest in more of this kind of research. place-based research looking at procurement policy and where food comes from. It's particularly relevant, there's all sorts of a whole set of other questions in countries where we're focusing on food security and on supply side issues, but in the Caribbean, is it we're up against it when they are chronically dependent on imports. And how much do we try and push back the tide on issues like how they are increasingly dependent on imports, particularly under a changing climate?
Yep.
Any other?
Yeah, I think one of the issues too that we have to, especially in small island states where we do have this dependency on imports because of local capacity, is to make a distinction between the quality of the imports. So if you're going to import fresh tomatoes, that's one thing, but importing Spam is something completely different. But then you come up again against the World Trade Organization rules, which says free trade. So I don't have an answer to your question.
Well, it's not an easy one to answer. I think there are, Jean-Claude, you had your hand up, but I think that there are more and more conversations going on from these different sectors, including through this process of the Food Epi module of Informus, which brings those stakeholders together to really debate and prioritise the challenges faced in moving food policy forward. Did you have something else to say?
Yeah, I just wanted to bring back something we've discussed earlier and linked to your question. I think if we need to have more research to understand the implementation challenges of our policies, and I think some of those challenges may explain why we fail to connect the supply and demand side together. But the implementation of policies will only be successful if there is no or less influence and interference from industry. It's a very biased statement that I'm making, but in which I strongly believe. We are seeing that whenever governments are devising policies for the people, they are being overthrown by the West. So we see now this in Bolivia, we saw this in Brazil. So Brazil has this beautiful dietary guidelines and this nice food policies, but each of them are failing now because of this change of government. So I think this is it's a very sensible subject, but the corporate captures of government and of policies is one factor that disable us from advancing. And for example, if we think about organic food, we have a lack of evidence, but because I think we didn't have a science that was truly free and independent to produce that line of evidence. And so I think for the same thing with other subject, we have to pay attention to those activities of influence that are affecting not only policies but also research. Sometimes it's legal actions, and they are undermining the small advances that we see. So whatever we see, Chile is interesting, but this could, they can go back to square one like this with a change of government. So I think this is a very important issue because, and just to finish, Canada is leading in a way. Our new food guide was developed without the participation of industry during the development of the food guide, and it's maybe one reason why we succeed in integrating the environment in our national guidelines, something that the Americans have failed to do. So we are, I think, showing that if policies are developed in a very secure environment, they could be more successful or more holistic and more progressive.
Thanks. I think we've got time for one more round of a couple of questions. Then I'll ask Santiago to join us for some final comments. But are there more questions? Please, Armando.
Armando Horizon from Animal Health, IDRC. We talk about, or you talk about sugars and other food components. I didn't hear anything related to drugs that are actually included in food, particularly beverages, and I'm talking particularly of caffeine. What's the research done on that? I mean, if I remember correctly, Coca-Cola used to use amphetamines in the past as part of their product, and it was banned and removed, I believe, in the 60s or 70s. So what are we doing regarding all these drugs that are included in food?
Thank you. Were there any more questions? This is the last chance. Okay. Other components of food which particularly make those...
Well, I think the question talks about, we need to pay attention to what's put into the food, basically. And so we've started to pay attention to that over the last decade only, the way we manufacture the food. So when we cook, we pay attention to what we put inside a recipe. The same thing, we need to really pay attention to the ingredients and techniques used to produce those foods. Same thing, we need to pay attention to the way we produce food. So I think more and more we are thinking about the way we do stuff, the way we produce, the way we process, the way we cook, more than just the nutrients found inside those foods. So personally, I don't know how to answer to your concern, but I think we need to start paying more attention to the ingredients used in the products that we consume.
And actually, that brings us the next challenge, that is defining what is healthy food, because we have defined it, at least in Chile, we have defined it as low in sugar, saturated fats, and so on. But actually, these are very nutrient-specific driven definitions, and we are seeing how food additives, not just these drugs, but of course non-caloric sweeteners, has increased, and other additives. And now we have learned that even with this ultra-processed food experiment that it was published this year, that even matching with the key nutrients, you will have a decreased health and overeating with the food, ultra-processed food itself, maybe because of all these additive, non-nutritive additives. So, and it brings also to the replacement when they were asking before about what happened when poor people cannot afford sweet beverage. We need to replace them with water or natural food, and this is redefining what is healthy food, what is a healthy diet, not just based on nutrient, may be a challenge for the food future.
Was there something else quickly?
Yes, one example, I think one trend we're seeing right now is the vegan products, right? So this is a new thing. We need to pay attention to those products, and some could be healthy and good for the environment, and others might be ultra-processed vegan products that are not healthy. I wanted to ask Mary what she's thinking about these new products, but we need to pay attention to those, not because they're branded vegan that they're necessarily healthy, but maybe customer will feel that. So we have to be also on top of the new innovation but it's a good example.
Yeah, and I think one of the things I just add very briefly what Jean-Claude said is there's two things going on, and I think we have to really be cognizant of that. There's what the composition of the food, and you talked about the organic, but this whole issue of vegan. There's the perception of the consumer, but actually that food, and those two often don't necessarily align either in a number of criteria. So, we have to keep the evidence and the science thinking there's two fronts, because you can't underestimate the power and those desires of the consumer. And if the consumer has a perception of something, whether it's right or wrong, that's what they're going to be looking for. And shaping those consumer perceptions is a whole other area of research that isn't as easy to do or to change their behaviors when they have those perceptions. So I just think that we just have to keep in mind that those perceptions and what the actual food aren't always necessarily in concordance.
Right. Thank you. We're going to have to wrap up. I'd like to say thanks to Jean-Claude, Mary, Marcella, and Alafia for a really interesting discussion. Wish us well tomorrow. We've got to do all this within half the time at the Canadian Science Policy Conference with an audience we don't know, and it'll be interesting to see what questions come up there. I'd like to invite Santiago, who's my boss and director of our agriculture and environment teams, for a few final comments. And thank you to you all and everyone who's been with us. Yeah.
Thank you. Thank you, Greg. I'm between probably your lunch, so this is awesome. time and so on. So I'm between your lunch and the rest of the day. So and thank you for to the panelists. Thank you for the discussions and the participants. Maybe only a reminder. Recently, in the last month, in the Committee on Food Security in Rome, there was probably only one message that was clear for all the delegates: is that the food systems are not working. And the other thing is that the food systems are plural, are not the food systems, and they are different. And there's going to be a complexity, and the next 10 years are going to be even more complex because climate change is going to be there, because cultural aspects, because inequalities are increasing. And that's actually one of the discussions that we are having right now. It was late, actually, because the IDRC is looking at the next 10 years of research and our strategy. The complexity of those elements of agriculture, we were hearing what is the production, of the cultural aspects, of the health components, of the markets, of the limitation of climate change, among all the other things, are going to be the core of what we do from IDRC. And actually, I think something that we saw today is the cross-collaboration. Research and development was never, but it's not going to be ever, a north-south discussion. It's a south-south, it's a south-north, it's a north-north. Those conversations that we have today are going to be what we are going to be doing the next 10 years. And we can do it because actually we have learned from the experiences that we have had for the past 5-10 years in agriculture and environment. IDRC, from the beginning of the last 10 years, we integrate climate change, agriculture, food security, and food, environment, and health together because we thought that those was the way to go forward. I think there's a lot of still that we need to learn, but that's where we're going to be going. So be with us, keep engaging in these kind of discussions because we have at least another 10 years to solve the food systems. With that thought, thank you very much. Merci beaucoup. Merci. Thank you.
And thanks everyone for joining us. And it looks like there's a little more than the sort of 2 to 3 centimetres that they were forecasting that I saw. So good luck going home. Thanks very much.